This is a public service. I was wondering if you had the manager's business card available.
What you are working for? You just.
Yeah, I'm doing a story on the health department and WIC.
Okay. Hi. So he's looking for your.
Do you have are you the manager?
Supervisor. Yeah.
Are you the manager of the WIC department?
I'm the supervisor for WIC. We have a director upstairs. Would you like to speak to her?
For WIC or for the health department?
For WIC.
Do you have their card?
I don't have a card for her. I can call her and have her come down. She may have one.
I mean, I don't want to take her away from something, but maybe you could just write her name and her email on a piece of paper, and that'd be sufficient for me. Thank you. And I'm sorry, what was that young lady's name?
Donna.
Donna?
Hannah.
Hannah. Hannah, thank you. And what was your name?
Melody.
Thank you, Melody.
Yeah, no problem.
So, Jamie is our director. Kara is our coordinator.
All right.
Sorry, my handwriting's a little messy, but
No,
it's
that's
just
perfect.
first name dot last name at flhealth.gov.
All right, perfect. And you're Hannah.
Hannah, yeah.
All right.
And I'm just the Viera supervisor down here.
Okay.
Do you need help with anything?
No, that was it. Thank you very much.
No problem. Have a good day.
You as well. Thank you. All right, well, Hannah was pretty great. It's a lot bigger than either of the other locations that I've been to.
Can I help you?
No, I'm just taking a little tour of the building. I appreciate that. Though, what was your name?
I'm Laurie, and you
Oh.
are?
Foshin.
I'm sorry?
Foshin.
Foshin, and you're with?
I'm an independent journalist.
Okay, and
Yeah.
you write for?
Well, I'm independent, so yeah.
Okay. So do you usually have anybody that you write for, like in particular? Do you
Well, there's
articles for? So I
yeah.
keep my eyes out for
Yeah,
you.
I write matters of public interest, so I'm doing a story on Brevard County, the health department, and WIC. I'm doing it for the whole state, but today I'm doing Brevard County. So I've been to the location down in Melbourne today, and then I think I was in, where's the other one?
Titusville.
Titusville yesterday.
yeah.
So
We are actually separate from the health department. We are a free medical clinic.
Okay.
Space Coast Volunteers in Medicine, and we are a free medical clinic for people who are at or below 200% poverty level.
okay.
And if they qualify, we see them here. Everybody in our clinic is a volunteer. Our physicians are volunteers.
So is this the only location that you guys are at?
Yes, it is.
Now, this is a lot bigger than the location in Melbourne and Titusville, and it's a heck of a lot bigger than the Flagler County location as well as Volusia County. So this is the biggest place that we've been to. So it's great that there's even more help being provided, because
we're fairly small. We have 5 operatories here. Operatories. I used to be in
Doctors?
dentistry. 5 exam rooms.
Okay.
But we have 47 employees total that are
Oh, wow,
all
that's not small.
volunteers. And
All
we're
volunteers?
all volunteers. Everyone here, we
Wow.
fall under the sovereign immunity state of Florida. And that's what protects
Do you
our
guys have
physicians.
do you have a business card
Let
or
me get
anything
your
like
business
that?
card.
Yeah, thank you so
Absolutely.
much. Yeah.
Absolutely.
All right, guys. Well, we've got Space Coast Volunteers. They're completely volunteer organization. She says there's about a little less than 50 people under her management, and that's pretty awesome that they're an entire volunteer organization out here to help the community.
Here you go. This is me. And here is, if you want to go online and check us out right here. And here's just a copy of our card. We work really hard to get out into the public. We started in Melbourne years ago and came over here in 2010 and just serve the uninsured, those who fall in the cracks. They've been laid off. They can't afford their insurance if they ever had insurance. And we just love on our people.
Yeah, well, you guys are doing yeoman's work for sure. So I certainly appreciate the service you guys are providing to the community.
Thank
That's
you.
awesome.
And tell me your name again. You're
Foshin, it's a strange name. Foshin.
Is
Yeah.
that your first name?
Yeah, Foshin. Yeah, my
Foshin.
last name's The Good. So The Good. The Good.
I love that. Well,
So are you before you did this? Were you an RN? You seem
I was
like a
actually a
caring
phlebotomist.
Okay,
I was
awesome.
a phlebotomist,
All right.
and I spent years in dentistry, did everything in dentistry, and then taught school while my kids were in school, and my husband retired, and then I retired, and my husband's our director of IT,
Okay.
who has gives his heart and soul to bring us up to and above and beyond, allowing us to go from a manual clinic to an electronic clinic.
Yeah,
And it used to take us an hour to get a patient qualified. Now it takes 15 minutes.
that's very nice.
So it's wonderful.
So
It's wonderful.
So what is your greatest referral source? Is it the actual health department, or how do people find you?
Well, we work hard to go into the community as well. We've partnered with, we have a volunteer who's our outreach, a director of outreach, and she reaches out into the community, and we provide them with information to give to their employees who can't afford health insurance, and let them know that if they qualify, to call us and let's get them, see if they qualify. If so, we get them scheduled, bring them in. We have 2 gynecologists on Mondays. We have we're primary care mostly. We do have 2 ENTs that donate their services, and they come probably once a month. We have nurse practitioners. We have a bilingual MD, and our Dr. Jones has been with us for years, and he's one of our other MDs. We have pharmacy medication that's been, our pharmacists go out and find medication, work with other drug companies to get medication donated to our clinic. So if a patient needs an antibiotic or something, we can give that to them and send them on their way.
All right. Wow.
So
That's awesome.
It's a blessing. Everybody here we're family.
Yeah, well, you got 50 volunteers.
47 actually.
Yeah, wow.
40, we may be at 50 now. That was our last number, I think, as of December, but we've added a couple more.
So, what is your biggest leadership challenge when you're working with a group of volunteers? Are there leadership challenge when people are just here to give?
Communication.
Yeah, okay.
Communication. And I stepped into this role. I've been here for 4 years, and I stepped into this role as director in September. And Audrey, who was here before, retired. She was here for 10 years, and she has a grandson that she needs to give some special attention to. So I stepped in, and I would say the biggest challenge for us. Thank you so much. So good to see you. Thanks, Highland. Bye-bye. The biggest challenge would be making sure everybody communicates, and that we, I think that's probably the must.
Yeah, I would
The
probably
must.
agree. As far as leadership goes, that communication is usually where things fall apart and where things can oftentimes be repaired, but
Right.
aren't repaired because people, they fail to recognize the vitality of
Yes.
communication. So whether that be inner department or inner office or inner business or between the government and the people, I mean, communication is so key. So
They've been wonderful. They're great partners. The health department, great partnership with them. I mean, just everything from the staff to the way they treat their people to if there's something they can't address with their guidelines, then we can here. So they've been there. We have a great relationship with them.
yeah, well, I came down here basically first, but I mean, the other two locations, it's been a night and day difference. I realize that somebody wandering through your building with a camera is probably a little
I didn't see
strange.
that. What I saw was I wonder if there's a patient. Somebody needs
Oh.
care. So, and I don't. Our clinic closed at 1. I haven't closed yet, and I'm going to go over to do the admin side. But I saw you walking through, and then I saw the back of you, and I thought, I wonder if he needs care. So, I was going to see if you needed to get qualified. And I was.
Well, I
That's
appreciate
what we're
that.
here
Yeah, I
for.
appreciate
That's
that.
what we're here for.
Yeah, thank you so much.
Thank you. It's such a pleasure to meet you.
Yeah, likewise.
And
likewise.
bless you on your freelance writing. That's hard work.
Yeah, it is.
That's
it is.
hard work.
There's an appetite for it, but it is. You're right. Because it's communication. You're dealing with. You're dealing with sometimes people that don't want to communicate with you. You want to communicate. You want to get your message out, and then there's others that they want to hide in the darkness, and that doesn't really help anybody. So
we had our Christmas party in December. We run strictly on donations. So we try to write grants. We try to someone passes away and they want to donate money. That's always a warm welcome, but we don't.
Do you guys work with local Rotary clubs at all?
We actually just put together our board. Our board retired in September, so we just started a new board. We had our last meeting last month, and at the end of February, our new board president is meeting with the Rotary.
Okay. Yeah,
So,
I'm not sure how the clubs are down here, but I was a member of a club up in Volusia County, and Rotary just wants to help people, and it's great. That's what you need is more people that want to help like you do.
Exactly. And then I think the other struggle for us is reaching into the community and finding providers who will see uninsured patients. And
just from a liability standpoint or a risk of liability standpoint.
For sure, liability.
Yeah.
But just yesterday I had a procedure. I have an electrophysiologist for some heart rhythms, and I had a procedure, and I was asking myself, I've got this patient, and I'm really worried about him. He needs care. And he said, you know what, send him to me. I'll take care of him. And really, I think it's about asking.
Yeah.
There's a lot of good people, a lot of good providers in this county.
Why do stories like this need to get heard?
Yes, and if we can bridge that gap and whatever we can do to let people know here. What I started to say was in December we had our holiday appreciation, and our community outreach coordinator went out and she worked with 32 community restaurants and vendors, and they donated food, they donated gift cards, they donated every one of our staff members walked away with something, with a thank you. And in exchange, we put our information out there for them. Here we are. If you have any employees that don't have insurance, please send them to us.
Yeah, people crave appreciation. That goes a lot further than a paycheck. A lot of times, it's just feeling valued. So. God bless you for doing that.
And we love our people. We love our patients. It's when if they get insurance or they go on to Medicare, and we have to lose them. It's sad.
Yeah. Well, a family environment is that's awesome.
So again, nice
Person,
to meet
yeah,
you.
good
Do
to
you
meet
have a
you.
card at
I
all?
don't.
Okay.
If you look, you can find a good amount of my work on YouTube. This is a public service, so just judge gingerly because it's just a camera, and a lot of it depends on how the other person interacts with it. So,
Sure.
but you're gonna make your facility look absolutely wonderful. So,
Oh, well, you know what? It's not ours, really.
well,
It's
yeah,
we're all,
well,
we're all
well,
here.
you're the steward for it, and you're doing an excellent job. So I appreciate the work you're doing.
I appreciate you. Thanks
Yeah.
for coming in.
Yeah,
and
thank
I was
you.
getting ready to give you a physical. Not give you a physical. Get you signed up.
Well, I appreciate that. Have a good day.
Great day. Bye bye now.
Wow, Laurie was freaking awesome. Oh, pretty big facility. Looks like 3 different clinics. Sterile providers. Miss Huswarn, I don't want to take away from somebody else's attention, but do you have a card for the health director or the health officer of this building?
I don't personally, but I can see.
I'd appreciate that. Thank you.
Were you looking for the nursing director?
No, the health department.
For here in Viera.
Okay.
All right,
And what was your name?
I'm Joanne.
Joanne. Thank you very much.
You're welcome.
You have a great day.
You too.
All right. Cynthia Ramos. Here in Melbourne. So this was actually the person that I was trying to meet with yesterday. So that was nice. And how fantastic was Laurie? I wish there was something that I could do to help Laurie and what's it called again? To help Laurie and the Space Coast Volunteers in Medicine. What a genuinely good person doing absolutely good things. We need more Lauries in the world. That's for sure. We're out here today to ensure our constitutional rights are respected by those that swore an oath to support, protect, and defend the rights of the people. The purpose of all interactions is to peacefully promote government accountability and transparency. This is a public service.